You're tuned to Radio Kidnappers, the voice of Hawke's Bay. This is a program called Real Wealth, and it's our pleasure, as always, to have in the studio Trudi from the Studio Group in Hastings. How you going, Trudi?
I'm great. How are you this morning, Ken, aside from hot?
I know, we were just talking about before we came to air. It's oppressive, the heat, isn't it?
It's, as you said, it's tiring just doing nothing.
Yeah, and you can almost put up with it during the day, but it's at night when it really gets you.
Oh, God. I was just saying I had my fan on me all night last night and woke up and was still like a mess.
Yeah. Yeah, well, I was trying to watch the cricket a bit earlier on.
Oh, that would have been a bit sad.
Even with the doors open, it was not only was it depressing watching us get beaten, but it was almost too hot to sit back and enjoy watching the cricket.
A cold drink. Poor us.
That's right. Oh, no, God. It's almost like living in the third world country, isn't it? Today we're going to talk about insurance, which is your forte. But before we get there, just remind our listeners, we want to come and see you at the Studio Group for some financial advice, because you've got a whole team there.
Yeah, there's a whole lot of us there to help you. We're based at 204 Karamu Road, out here in Hastings, and our number is 878-8961.
Now, last time we spoke about why we need to review our insurance, and probably at least every year, every couple of years,
yes,
come and see you, and it's free.
It's free. All it is a commitment of time.
Yeah, that's right. And why wouldn't you want to do it?
Exactly. Make sure that what you've got is what you need.
Now, today we're going to talk about health insurance, and I guess a lot of people are thinking, well, why would I need health insurance? Got ACC? Or got the hospital? Absolutely.
And I mean, we're really lucky we live in a country that does offer free health care. I mean, imagine living somewhere like America or places where they don't have anything. The issue that we're finding with people is waiting lists. People have some sort of injury or something that needs medical attention, perhaps surgery, and they're put on waiting lists. And we're finding that generally people are waiting sort of 3 months before they either get to see a specialist or have the treatment that's needed. Now, of course, this is going to have a huge effect on your life. You either can't work, if you've got something that precludes you from working. So you've got that financial stress and perhaps pain. I mean, it can be awful with some of the things that people have to live with. And you could potentially be getting worse in that time frame. So it's huge just to have the benefit of being able to go, right, I can actually go and see that specialist on Friday or next week, and you've got it booked in and you're not waiting or being bumped off the list if perhaps a more urgent case comes on.
Just let's jump the queue, doesn't it, really?
Well, it actually takes the pressure off the public health system as well. You've got to look at that. There's fewer people on it, so it benefits everyone, private health care.
It sort of makes you wonder why it's not a bit like America, where health insurance is compulsory in a way, isn't it? I mean, if we all paid a couple of bucks a week.
Well, I think over there seems to be an issue of people just not being able to pay. I mean, it's just so much more populated than it is here, and that's what I like. We have actually got something for everyone, but for those that perhaps have the need for it, they can self-insure, pay for insurance themselves rather.
I read an interesting case, and it did happen in America recently. A guy got bitten by a snake. Yeah. And it cost $275,000 to treat him.
Wow.
And he was fortunate to have insurance. Yes, he had insurance.
Well, there are other things that just having a baby. Now, I mean, who thinks about how much it would cost? My daughter recently had a baby, or 2 babies, in Hastings Hospital. I was just blown away. I had my children in England, obviously in the dark ages. Yes. Now they've got pools and everything. I was just blown away the level of care that they got. And it's free.
Yeah, I know, it's incredible. I recently had a brain scan, and it cost nothing.
Yeah.
And imagine what that cost to turn that machine on, that MRI machine.
It's thousands.
It would have been thousands
it's
of dollars.
Thousands. Yeah. And I mean, you had that done on the public
I had a bit of a brain bleed, so I had to go in, and they just took me straight in, which was great.
Yeah.
And wow, what fantastic service. And it would cost me nothing.
It cost you nothing. And that kind of brings us on to another point. Of course, with the public health system, with emergencies, it doesn't matter whether you have private health care or not. Everybody's seen straight away. I work with somebody who had a heart attack, and that was a block stent. Now, he had healthcare, but it wasn't needed.
No.
So for emergency treatment, it's great.
Right.
This is not what we're looking at
we're
covering.
Not. We're talking about everyday health issues. But what happens if I've got an existing problem and I want to apply for some health cover?
It's a good point, yes, because that's the thing is, am I going to get cover? Generally what happens is the insurer will give you the cover that you request, but they will exclude anything that's happened to you up until the time you took the cover out. So if you've got something wrong with you when you go for the cover, they won't cover it going forward. And that's pretty standard with health insurance. Sure. And it's kind of another reason why it's quite good to get in earlier rather than later, because we tend to get more things over a period of time. We're more likely to have more happen to us.
Absolutely right. So there's health cover and then there's health cover. That's what you're saying? Yeah,
exactly. And the thing to remember is there's a lot of things that can go wrong. Not to be doom and gloom, but the possibilities are endless. So it is good. I mean, we've got people, couples, they have their health cover, and then as their children come along, they'll put them on generally from sort of birth or 3 months, that kind of thing. And that means that anything except for congenital problems are covered. Yes. Which is fantastic. Another point I just wanted to make, I was just thinking back to your kind of question before, and waiting lists, that kind of thing. If you've got children, I mean, some of the classic things that children have are tonsils, adenoids, and grommets. Now, I know from my own children and other people's, if you've got children that has chronic tonsillitis or ear infections, you're the one taking the time off work while you're waiting for your children to have that. That's a horrible feeling. I mean, you've got your own health to deal with, and you're also having to take off either sick leave or annual leave while your child is on a waiting list. So again, it's just another reason you can go in next week, pop in, get the procedure done, and then it's back to normal.
Yeah, that's right. Minimise all that.
It's very, very stressful.
I wonder if you had to prioritise health insurance. I mean, we've talked in the past about life insurance. You can have mortgage insurance, you can have insurance for this, insurance for that. How far up the list is health insurance in your opinion on a scale of 1 to 5 or 1 to 10?
I think it depends, and I can never give you a straight answer, Ken. Every week you try. But it really does depend on a person's circumstances. I would say generally if you're a younger family, you've got your children, maybe just one income earner while the other one is off work, then you want to be looking at things like life insurance and income protection insurance. For me, the health insurance is fantastic.
Yes. And I suppose it's a classic case in that when we're young we think, who needs that?
Oh, who needs it? Well, you're bulletproof.
Yeah,
nothing bad is ever going to happen. I mean, can you remember back when you thought you knew the answer to everything and you thought anyone over 30 was stupid?
Exactly. How do we know what cover's right for us, though? I mean,
Well, that's where a financial advisor would come into play. Generally, I would look at covering the big ticket items, so the expensive surgeries, because they're the ones that are harder to fund, a $15,000 hip or knee surgery. So that's probably where I would start with. Then you have just multitudes of things that you can add on, which is like your specialist and test cover. So being able to see a specialist quickly and have that paid for in certain tests. Then you could have dental cover, you can have eye cover. What else do? They even physio, nutritionists. Kind of the sky's the limit, really.
The list goes on and on.
Yeah, so I tend to start with the big ticket items because they're the ones that are going to be hard to fund yourself.
Is it expensive?
Quantify. It depends. It depends what cover you're looking for and who you're covering. I mean, I just did a quick quote before I came out to be able to give you a rough idea of cost. And if you're looking at a couple, say, around 30 with 2 children, so they're still dependent, you'd be looking at about $30 a week, and that would be for your hospital cover, your expensive one.
What do you say to people who think that $30 a week, for instance, that's $120 a month, that's $1,200 a year? I might say, well, if I put that money in the bank, because I'm not going to be sick for the next 10 years. I mean, I'm touching wood as I say this, but apart from that incident that I mentioned to you a bit earlier, I've only had 5 sick days in my whole working life.
Yes, I love
have I told you that before?
You mentioned it once or twice. You've got a very good work ethic. Yeah, I'm impressed. Yeah, well, I guess not everyone is as lucky as you. And everybody has different things goes on. And if you look at the odds, if you've got 4 people covered, the odds are you're going to get your money's worth. And often it will be just one thing will more than pay out for what would have perhaps been 10 years. And you'd kind of want to have 10 years of savings, because if you're looking at sort of 10, 15,000 with 4 people, I mean, that's a lot of money to have put in the bank.
Dead right there.
It's kind of a way of budgeting it as well. You've kind of paid for it in advance.
Yes. What about excess?
What about it? It's a great way of keeping your premiums down. So you can say, okay, I've got $500 or $1,000 put aside for an excess in a year, and then that way it manages your premiums. So it's really good. And it's also, as you get older, perhaps, as we know, everything gets more expensive for us, it's a way of keeping perhaps your health insurance going a bit longer and just increasing or putting an excess on it, so you don't need to cancel it altogether. Yeah,
I mean, I know someone recently had an ankle done. It cost more than $20,000.
Yeah.
So, there's your money saved right there.
Well, kind of, exactly. And you might only need 1 or 2 claims. It's the stress and the waiting that's associated with it. It kind of gives you the control and gives you the choice, and you're not relying on other people, and you can book it in around work how it suits if you're still working. That's what private healthcare does for you.
I wonder, just as an aside, when we haven't got this question on our list, and I just thought about it as we were talking, I was talking to a chap a couple of days ago who has a travel program on Radio Kidnappers, and we were talking about the benefits of having travel insurance for health issues, because if you've got to go to a hospital somewhere else in the world, it could cost you your life savings. If we've got health insurance locally for within New Zealand and we decide to go to America for a holiday, are we covered under our policy, or do we have to have an extension to that?
Generally, they're 2 separate things. Some health policies will cover here and Australia, but you'd want to double check with either the insurer or the advisor on that, so that you might need to still get health travel cover as well. But it's just local to the country that you're in.
Now, we touched earlier on emergency situations. Tell us a bit about that.
Well, if you have an emergency or a life-threatening situation, we're not in a country where anyone would ask you what's your member number for whatever health provider you're with. You just go straight in there. So it makes no difference. If it's life-saving or emergency, you go straight in and get dealt with. This is purely for those things that are non-life-threatening, non-emergency.
Now, we're talking about... obviously it's a great idea to have it. Realistically though, at what age would you recommend that we decide to have health insurance? I suggest we're going to say at any age, but is there a time and place that you might say, look, okay, for instance, when I was 18 and I was in the workforce, I wouldn't have given a second thought to insurance.
No.
And it's actually not until I've been speaking to people like yourself over the last few years in my job here that you realise, you've got a good point. But the average person doesn't think that way, do they?
Doesn't think. I mean, more and more I'm coming across people that have had health insurance as children, and they've transferred it over to themselves as adults. So, this has been going sort of 30, 40 years. Otherwise, I would say, I think as soon as possible. And the reason for it is you're less likely to have any pre-existing conditions. I mean, you may still have had a few things, but not as many as maybe over 30 or 40 or 50 years you might acquire. The other point is, if you haven't got it sort of youngish, sort of 18, 25, then when you have a family and you're the provider for that family, where you having to take time out of work affects them, or were you having to take time out of work to look after your family affects everyone. So that's also another key point.
Sure. Now, often you talk about disclosure. How important is it for us to disclose conditions to someone like yourself or to the insurance company? Because you might forget that you had the measles when you were 5. You know what I mean? The questionnaires are usually pretty robust, and they ask a question in about 5 different ways to try and trigger your memory. We as advisors also prompt people to put down everything and to send off, because full disclosure is really vital. Yeah. Now, I know in my own situation, I used to have, many moons ago, the company I worked with was very generous, and they gave us full cover for our health, not only for ourselves but for our spouses as well.
Yeah.
And then when I left that job, we decided that we'd keep it going for a little while, but it really got horrendously expensive, so we kept some of it on for my wife. How can you manage some of the premiums moving forward that, when we take them on as relatively younger people, they're not so bad?
Yes.
But as you get older, of course, what they say is, oh, this old guy might need some
well,
work done.
Again, as you get older, there's the likelihood that if you've been living as hard as you have, Ken, you're going to wear something out and need something replaced. So yes, the premiums do increase. So we could look at things like putting on an excess or increasing an excess. You could look at perhaps taking off some of the add-ons if you've got dental cover, your vision, even specialists and tests, so that you've got your core, which is your hospital cover. Now this again would depend on what your health was like, because I would say if somebody had a lot of health issues, you wouldn't want to be taking cover off, you maybe just want to be putting an excess on.
Yeah. Another thing I found as you get older, I've had a couple of frozen shoulders in the last 10 years, and they literally last for a couple of years before they come right. And when I went to see the doctor in the first instance, he said, I said to him, well, would it be covered by ACC? And he said, well, in a perfect world it would be, but because you're over 54 years old, it's probably considered to be wear and tear.
Yeah.
And I guess a lot of older people are finding that, so it's just starting to wear out, and it's just wear and tear, buddy. But if we had health insurance prior to us getting the frozen shoulder, we'd be covered, wouldn't we?
Exactly.
Yeah.
Exactly. Yeah. For any qualifying health situations, you're covered. I mean, there's a huge list of what they cover there, so it's always good to know what that is. But yeah, it is good to have that in place. And often people have kind of injured themselves at work, and the injury has healed, but it's kind of left. You find that a lot with people having arthritis or problems going on. So as you said, yes, ACC won't cover them, but they've still got this condition, and 54 is not that old, and they still need to be able to work.
Yeah. So your health insurance provider is unlikely to pull out that nugget which says, oh, by the way, you're just getting old, so we're not going to cover you. They're going to cover you, aren't they?
Yes. Yeah. If you've got the cover in place and no exclusions, and this is a condition that's covered, they're not going to turn around like ACC. It doesn't matter whether it's an injury or wear and tear to them. Yeah.
Now, before I let you get back to work, there's another thing we need to consider, and I mentioned it in my own case that we couldn't really afford the premiums, but what can we do to minimise the effect of premiums?
Well, it is always looking at, and again, do it with an advisor, because every case is different, and some people may be able to take off more than others in terms of cover, because they haven't, perhaps like you, haven't had too many health concerns. So you'd look at reducing it to the most expensive items that you could claim for. That would be my suggestion. So the things that are harder to fund yourself.
Sure. So,
and I mean, we're talking about claims as well. You talked about 10 or 20,000. We're seeing them for sort of 150.
Yeah, I bet.
180,000. I mean, we're notified all the times of the cost of claims, and it's just with all this sort of innovation that's going on, there's just so much more potential to what can be done.
If we want some advice about insurance, or in fact any financial advice whatsoever, where do we find Stewart Group?
Well, we're 204 Karamu Road in Hastings, but if you'd like to give me a call if you're concerned about your insurance or your health insurance and just want a sort of a sounding board, I'm happy to talk to people, and our number is 06 878 8961.
Trudi, as always, our pleasure. You look after yourself. We'll talk to the same time, the same place next time.
Lovely. Thank you, Ken.